Hello, my name is Dr. Martin Wanendeya. I'm a general dentist based in Clapham and Balham in southwest London, and I'm here to talk to you about one of my passions, which is innovation within dentistry and looking at how medical innovations are going to change how we work today, potentially. What I'm going to start off by talking about is we're living through the digital revolution at the moment, and the digital revolution is one of the biggest revolutions that we are going to know as a species. We know that it's going to be bigger than printing, we know that it's going to be bigger than writing, and it's happening right here now. And what we know is the better we get at being better, so i.e. as we improve more, we get better at improving, so the rate of change increases. It means that all of the gadgets, all of the things we use, we're going to get smaller and get faster and are going to get cheaper, we hope. We know this because we're prone to innovation. This is part of our DNA as human beings. People are always going to find a way to innovate. And if we look at the next slide, if we look at this slide taken off Wikipedia that looks at the storage in your iPhone. Now, when you look at this slide, you think, okay, the storage on your iPhone has improved. But in order to actually see the pattern within this, what you need to do is you need to break it down and you need to look at how much the storage has increased over these periods of time. You see that actually between the iPhone 2 and iPhone 3, there was that change. The iPhone 4 was that change. The iPhone 5 to 6 was that change. That's 64 gigabytes, you can see there. That's 128 gigabytes. And finally, that's 256 gigabytes. So that's how much the storage in your phone has changed, something that you've all lived through if you've bought one phone and then a second phone and then a third phone. However, if we then take this from another perspective, if we look at the rate of change per year of your phone, you'll see we start to see a very different story. We start to see that the rate of change goes from 8 gigabytes a year to 16 to 16 to 21 to 64, finally to 128 gigabytes per year. So if you look at 5 to 10 years later, the rate of change has gone from 8 gigabytes a year to 128 gigabytes per year. Now, if we take that data and we plot the rate of change, what we tend to see is a curve that looks like this. And when we look at that curve, what it lets us know is that we're looking at an exponential curve. The reason for talking about that is if you look at Ray Kurzweil and what he talks about the law of accelerating returns. What this means is, if we look at where we are now, here, if we stand on this point, and if I try and predict what's going to happen, I'm only looking here, and all I've got is the data from things that have happened in my lifetime or that I've seen. And so what we get is this. This is an intuitive, linear view of what's going to happen in the future. This is what we can see. But looking at the previous curve, where we looked at the rate of change of storage in your iPhone, what we know here is actually, historically, this has been the rate of change, which is exponential. So it's very hard for us to see what's going to happen because we always have a linear view, and it's very, very hard to have an exponential view of the changes that are coming our way. And this comes back to that sentence. The better we get at getting better, the faster we will get better. So with that in mind, let's take a view into several technologies in the future. So I'm going to look at some of these different technologies and explain how they work and how they're going to affect what we do now and what we might do in the future. So the first thing we're going to do is we're going to look at 3D printing. And in the past, what we saw was within 3D printed bone was something that was played with and, in some ways we toyed with. But now we're at a point where actually 3D printed bone is possible. And here you can see where a zygoma has been 3D printed based on some reconstructions that have been done digitally on a computer. And then this sort of thing has been placed into a patient, and has been used as a scaffold. Bone morphogenic proteins of different sorts have been placed into the scaffold, and within the bone morphogenic proteins, these have acted to actually grow bone within that scaffold. This is technology that's now being used in and around the face, as well as in different areas of the body. The other application which we're seeing 3D printed is we're now seeing this happen with teeth. So basically 3D printed teeth are being used where they're implanted with different substances that are antibacterial. So the idea of this is that you can have teeth made that are antibacterial by their very nature. And these can be used obviously to prevent people getting decay, prevent them getting gum disease. But again, this is technology that's being used right now. If we go back again to look at the different technologies, and we look at something else here, we look at nanotechnology. And if we look at nanotechnology, what you can see here is a very, very thin titanium nano, a very, very thin tube. And within this tube, basically antibacterial substances can be added so that as you have your implant placed, your implant is actually giving you the antibiotics that you need. And these antibiotics will then obviously are delivered locally rather than systemically, with all of the advantages that that entails. The next part we're going to look at is something which we talked about before, which is augmented reality. Now, in augmented reality, what we know is that there's a massive advantage to being trained in this way, because having the ability to be able to see, for instance, the CT scan and have this viewed in front of you as an augmented reality while you're doing the actual operation on the patient, as you can see right here, is a huge advantage in terms of having local anatomy displayed right in front of you so that you're working with this information in real time. So these systems are now available for surgeons to use. At the moment, they're a little bit big and a little bit clunky, as you can see there, and they rely on very large fields of vision and sensors placed in different ways. But over a period of time, these will get smaller, and they'll get cheaper, and they'll be used more often. Now, again, another more recent development is a camera that can see through tissue. This camera that can see through tissue works by showing a light and has a sensor. The sensor is what you've seen in this slide here. And this slide here, using that sensor, is able to see the light source within the body. At the moment, this technology is very new. And in being very new, it still, again, is going to go through some various transformations that we'll see. But the advantage of this is going to involve effectively being able to do real-time X-rays during surgery with no exposure to the patient. And again, there's huge advantages for us within the dental and medical field with this. What the company that I talked that makes this called Proteus, and it's important we don't confuse this with a different company called Proteus that again they proposed a tracking pill. This company has unfortunately gone bust, and that product is currently not coming to market. So looking at augmented reality, we can see that there's advantages as to how we're going to be able to use this and where we're going to be able to use that within dentistry and within medicine. If we go back again and look at another field, we look at blockchain and blockchain technology. I've spoken in the past how this particular platform, Ethereum, has linked up with this particular medical record storage called Medical Chain, but actually there's a new player on the market. And this new player is called Cardano. And what's different is that this has a very different proof of stake. This blockchain is built specifically so that it can be used for a variety of different technologies. It also has a very, very different proof of stake to many other cryptocurrencies or to many other blockchain technology. So one of the applications will be obviously blockchain and will be cryptocurrency, but there's many other ways in which this can be used. And it's very interesting to see how this develops, because the developers and the founders of this have built this specifically knowing what's happened in the past with blockchain in order that it can be scaled across a variety of different platforms. So this is certainly one to watch out for. We talked a little bit about another technology, which is robotics. And in the past, I've shown you this video. Now, in the past, I think as dentists, we felt that our hands were one of our most important features. It was very hard to imagine how a robot will be able to provide, get the feedback and provide the sort of surgery, the sort of delicate surgery that, for instance, plastic periodontal surgery needs, or composite bonding, something like that. But if we look at this picture that you see there of the Queen, if you look at the palette, and if I was to show you how that picture was painted, this picture was painted using a robot. This robot was a commercially available robot and was trained over a period of time by some artists. These are called Rob and Nick Carter. They trained this robot over a period of time to paint black and white paintings. The interesting thing about this is you can see the texture, you can see the shade, you can see the variety of colors that the robot is able to paint. Now, if that robot is able to paint, maybe one day that robot will be able to do some sort of surgery. The interesting thing is those artists have now moved on slightly in terms of their next creation is able to actually paint color paintings, and that was released very, very recently. So something to look out for in terms of how robotics is changing and how robots are able to perform much more delicate tasks than they used to be able to. Another thing, again, a very recent development. What you can see on the screen happening in front of you is this is a micro robot. This micro robot is going around, it's performing a task which is to clean plaque. Now, we can imagine where this can be used within dentistry. Imagine your patient doesn't want to clean underneath their full arch hybrid bridge. Use some nano robots to be able to clean underneath there. So technology like this is being developed, and what you can see here is the lab tray. It's being developed more and more in different circumstances. And I think what's interesting is going to be to see which of these technologies actually makes it out into the marketplace and makes it into commercial use. And that's something which, I can't or you can't predict. The next thing to talk about is something which I think is very close to our hearts as dentists. I often joke that I'd like my assistants to have 4 arms and to have some of them see-through. We could be close. What you can see here is this is a Royal College of Arts graduate. She's called Danny Clode, and she's been focusing on this product called the third thumb. Now, if you have a look at this, the third thumb is activated using a foot pedal. It can be used to grip, it can be used to hold items. So imagine that you're able to have this and use this in practice. The main thing is, and when we look at how this has been adapted, because in order to open and close the third thumb, you use a foot pedal or a foot tap in order to activate it. The best use of it so far has been with a musician who's been able to use that to play different notes. So can we imagine something like this could be useful in the dental surgery? An extra thumb for your nurse? Certainly I would accept that. I don't know about you. Something we always get asked about by our patients: when are we going to be able to regrow teeth? And if we have a look at a new treatment that's come out from the University of Kyoto, what they've discovered is actually if they block a particular gene, the gene is called USAG1, it led to an increased activity of bone morphogenic protein. And once they blocked this gene, it allowed mice to grow teeth, regrow teeth that had been missing. So our patients keep asking, University of Kyoto, hopefully you'll keep going with that, and we'll get a little bit closer to the future whereby we're able to regrow teeth. Finally, probably the biggest change is artificial intelligence. And for those of you that don't know the different types of artificial intelligence, I'm going to summarize this. So the first type of artificial intelligence is called narrow artificial intelligence, or artificial narrow intelligence. And what this is able to do is this is able to do one specific task and do that task very well. So for instance, a robot that's able to play a game, that would be an idea of something where we're able to use just one task and do it very well. The next part is machine learning. So this is a machine that's able to learn from its mistakes and get better. But again, within this, it's only able to do it across a very, very narrow field. So for instance, taking the example of the robot's able to get better and better at playing that game of chess, but it can only really play chess. Where we get to is a point which is deep learning, and this is called artificial superintelligence. And within this, what we've got is artificial intelligences that are able to pose new tasks themselves, solve those tasks by themselves, and then post other tasks themselves. If we get to this point, quite often called the singularity, this is when we believe actually maybe artificial intelligence will become more intelligent than human beings. We never know. There's lots of debate in the scientific community about when we reach this point, how we're going to reach this point. Is someone going to be the person who intentionally opens Pandora's box, or unintentionally opens Pandora's box? So there's lots of projects and lots of debate about the ethics of reaching the point where we have an intelligence. I'm not going to call it a computer anymore because it will be an intelligence that are able to self-learn. So if we look at this from your practice perspective, in terms of artificial intelligence, these are the different fields in which you'll see it used: diagnosis, treatment planning, record keeping, education, marketing. I'm going to touch on a few of these points. And just going back to diagnosis, this is where we're seeing developments. And if we look at aesthetic diagnosis, what you can see here is a case which is, again, using artificial intelligence. This is commercially available software that will only really get better. And this software is able to effectively take a photo of you, and then with that photo of you to carry out some sort of simulation to show you what you would look like with different appliances, and then for there to show you how straight your teeth would look. Obviously, there's some issues with how well it performs and the way it goes about doing this. But again, using artificial intelligence has allowed algorithms to calculate this. If we go a little bit further, One of the sites, again, this is available over the internet that you can go to, is a site that animates any photo. And when you look at the results are a little bit freaky. So if you have a look at this young baby, some of you may or may not recognize that young child. If you have a look here, that's it animated. So this is quite a strange feeling, looking at a photo of yourself as a baby animated just there. And this is, again, a young teenager that you can see there. Again, these sites and these things are available to us using artificial intelligence. It's able to look at the different facial features and movements and figure out how your face would move. That's just the basic end of the market. If we go a little bit further as to what you can do within this. Here's Tom Cruise.
In this reel, you're going to see my amigo, Chris Umi.
That's not really Tom Cruise. That's actually artificial intelligence that's been used using a variety of pictures of Tom Cruise that have been superimposed onto an artist's face to give the impression that's Tom Cruise. These are called deep fake videos. In fact, this very technology is being used today in how we look at CT scans, and there's obviously some ethical issues with those. Some ethical issues as to what is real and what is not. When you see a video, in the past, a video was the proof that something's real, but if a video can be deep faked, how are we going to live ethically with this? How's this going to cause, what sort of issues are we going to arise? More questions than answers on that one, I'm afraid. But back to the dentistry, we can use that same technology to actually diagnose as well as give reports on CT scans. I received an email yesterday that arrived in my inbox about a local scanning center that's offering this service, and they send along a sample report that you can see right here of a demo patient, where what they're able to do is to chart off this x-ray. From there as well, the AI is able to see where there's issues with the root fillings, missing teeth, restorations that need replacement. At the end of it all, this still needs to be checked by a human being at the end, so we need that input on top of it. One of the different ways in which we're able to use artificial intelligence is in looking at medical research. We know that medical research can be complex, difficult, tricky. It's very hard to understand it, and that's for you and I potentially as medical professionals. What's it like for a patient? How about if you have a particular type of cancer or you have a disease and you're looking to find cutting-edge treatment and trials? In the past, this would be very hard. You'd have to search and trawl different parts of the internet, look for different universities or institutions that were carrying it out. But now there is a site that allows you to look and to understand the different parts of cutting-edge medical research that are being carried out, so that you can have a look, find what your issue is, look to see trials that are available for you, should you choose to participate. So if you're looking for the latest in medical research, cutting-edge medical research, there's now a way that you as a patient can access that fairly easily by looking online and looking through an app. If we look at another aspect of this, which is record keeping, and one of the things is there's a company we've been using at work for a little while. What they're able to do is to automate your record keeping using artificial intelligence, and you can see it here at work. And when it's at work, you can see that you can very quickly go through, click different parts on and off. And by doing that, what it allows you to do is it learns what you're doing. And after a while, it offers you options based on what you're doing. Again, this is a way in which we can gain more time, and we can actually use artificial intelligence to our benefit. How about in marketing? How about when you had gaps in your diary, if you had a receptionist that was good enough to look at all of the gaps in your diary, look through every single one of your patients who had not been in for treatment, and say you had an hour gap and it takes you an hour to fit an implant crown, it was able to find all of the patients who had implant crowns but that needed fitting within your database. That would be the perfect receptionist, but this is the sort of task that can be outsourced to AI. And AI can automatically do this using this application that's available today. So it's called Chairfill. This is something that you can use and that is available in the States. How about in terms of medical records and AI? This is where we end up in a slightly tricky position, because the data in medical records is so dense and so difficult to analyze, but within there's lots of information. And that information, if analyzed properly, has a value. And one of the companies within Google's portfolio is called DeepMind Health. And in the past, they've been known for harvesting medical records and looking at that. And as part of this project called Nightingale, it went through lots of different medical records to look at what was there. And the issue with this is This was not illegal. It stuck to the industry regulations. But on the other hand, it's one of those areas where actually innovation has gone ahead of regulation. So the use of these medical records are that actually these records can be used to predict illness in different people. So by using it to predict illness, is that going to change what your health insurance offers you based on a sample of people who've come before you with similar symptoms or similar background, etc.? So this, again, one of the areas of AI which is difficult or slightly is tricky to regulate. What impact does this have for you? The impact is that the future regarding our relationship with machines is complex, and with artificial intelligence is complex. The relationship with different companies is complex. It's complex because, as I mentioned, there's this battle between innovation and regulation. Companies will always innovate. And once they innovate, they'll put products out to market. Once these products are out to market, the regulation won't be in place for these products because they're completely new. And if you're a company where you can gain a financial advantage through having a product that may or may not be regulated out, you're going to have a decision to make. Because you're going to have to decide if your values as a company you're going to put before profit, or you're going to put profit before values. So, in conclusion, we know that we have to change. We know we have to. We know there's a price for not changing. We know, if you look at this quote in front of you, there's a price for not changing. If we look at one particular company that did not change and got swept away by the digital revolution, another company that almost got swept away. But actually, fortunately, if we adapt, as the Kodak company did, then we will survive. So it's important that we observe, we learn, and the most important thing is we adapt. Thank you very much for listening today. I hope you've enjoyed this session, and I hope to see you again sometime.